Hi, I'm Peter Glowicki, Editor-in-Chief of the Journal of Vascular Surgery, Venous and Lymphatic Disorders. I'm also the Joe M. and Ruth Roberts Professor of Surgery at the Division of Vascular and Endovascular Surgery at Mayo Clinic, Rochester, Minnesota. Together with my new co-editor, Dr. Peter Lorenz from UCLA Medical School, we are excited to bring you our first issue of this prestigious journal, which is published now with a new cover, a fully redesigned table of content, and also a new page design. We are eager to hear your opinion and comments on how you like the new format and also on how to improve the content of this journal. I am pleased to introduce you now the highlights of the July issue, including the editor choice and 3 highlights from this issue. The editor's choice article is on how to improve retrieval rate of inferior vena cava filters. The paper was written by Dr. Inagaki and colleagues from Boston University and Boston Medical Center in Boston, Massachusetts. It is significant because retrievable IVC filters are often not retrieved. This is a retrospective cohort study combined with prospectively collected data from an interdepartmental registry. The take-home message was that retrieval rate of retrievable IVC filters was significantly increased with implementation of a retrieval protocol with a multidisciplinary team approach. The authors recommend establishing an IVC filter retrieval protocol and collect data in a multidisciplinary registry. The strength of recommendation of this article is strong, and the level of evidence is B, moderate quality. One of the other highlights of this month's issue is a paper on the next frontier of office-based IVC filter placement. It was written by Dr. Al-Sheikh and colleagues from Dr. Enrico Escher's group in Brooklyn, New York. Preliminary results of this retrospective study with early outcomes suggest that placement of IVC filters for treatment of venous thrombotic events in an office-based facility is safe and efficacious using basic endovascular equipment. The strength of recommendation of this paper, however, is weak, and the level of evidence is C, low to very low quality. Dr. Versteeg from Dr. Van Rie's group in Dunedin, New Zealand, investigated the natural history of ultrasound-detected recurrence in the groin following saphenofemoral treatment for varicose veins in another excellent paper. This is a significant paper because there is a lack of consensus on uniform definition of varicose vein recurrence after treatment and about the timing of follow-up. This is a prospective study of 130 limbs with 5-year follow-up after high ligation and stripping, and the take-home message is that early ultrasound evidence of neovascularization will not predict severe late clinical recurrence. So the authors recommend that duplex ultrasound detected recurrence does not correlate with 5-year outcomes of clinical significance. The strength of recommendation of this paper is 1, which is strong, and the level of evidence is B, which means moderate quality, with evidence from a long-term prospective observational study. And finally, another highlight of this issue was written by Dr. Musa and colleagues from Charleston, West Virginia, on validation of venous duplex ultrasound in determining iliac vein stenosis after standard treatment of active chronic venous ulcers. This is a significant study because there has not been a systematic investigation of venous duplex ultrasound criteria that would correlate with common femoral vein reflux with iliac vein stenosis. This is a retrospective study, a case series, and the take-home message is that duplex ultrasound reflux time of over 2.5 seconds in the common femoral vein predicts a more than 50% iliac vein stenosis measured with intravascular ultrasound in patients with venous ulcers. The authors suggest that a duplex of ultrasound reflux time in the common femoral vein predicts iliac vein stenosis in patients with venous ulcers, and that stenting and pentoxifillin aid ulcer healing and decreases recurrence. The strength of recommendation is strong, and the level of evidence is C, low to very low quality. These were just a few of the many great articles from our July issue. To access these articles free in the entire month of July, please visit us on www.jvascsearch.org. Enjoy our first issue, and please remember to send us your comments and suggestions. Thank you for viewing, and see you again next time for the highlights of the fall issue of the Journal of Vascular Surgery, Venous and Lymphatic. Thank you.